for pain relief, and they want to get on with their lives. Every office deals with pain problems very differently. Everyone, they're interested in helping. Some methods are more effective than others. I understand that you need to get on with your life, get out of pain. And when you come into my office, we sit down, we do a targeted consultation so I can understand your history, what your health goals are, what your challenges have been. And then we do a targeted examination and we look at a number of different aspects of what's gone wrong with your body as to why you're in pain. Pain is never the problem. It's a signal or a symptom that there is a problem. And we have a huge problem in our culture where people are taking tons of drugs, medications, whether they're over the counter or prescribed, in order to suppress the signal of pain. The problem is, even if you're effective at suppressing the pain signal, the underlying cause of why you have the pain is still there. And as you move, twist, bend, undergo different types of stress with your body, your frame, even in the silencing of pain, the areas that are imbalanced causing the pain go under greater and greater stress. And what happens over time is you're more likely to do more damage. So during the exam, we look at a number of different factors. We look at your bilateral weight balance. So you put one foot on each scale, and we're gonna measure where your body is in comparison from left to right side. So for someone, say, who's 200 pounds, ideally you would be 100 on the left, 100 on the right. And there's always a standard deviation that's considered within normal limits. So for men, usually it's about 2 to 2.5 pounds. For women, more petite, anywhere from 1 to 1.5 pounds. If we start to see that you're deviating 4 pounds, 8 pounds, 12 pounds, which by the way is very common, that's a very strong sign and clue as to where the pain might be coming from. Another part of the exam is it's actually a nerve thermogram, completely painless. Clients sit on the table. I'll run the scope from the bottom of the spine all the way up, and what's happening is these indicators are picking up thermal temperature differences from the 31 pair of nerves from the neck down to the lower back. Ideally is that the temperature of the nerves on right and left side should be exactly equal. That would indicate that the nerves are working properly. But we know with pain syndromes, whether it's neck pain, headaches, shoulder pain, wrist pain, back pain, hip pain, knee pain, a lot of the problems actually come from the spinal region, whether it's joints, bones, muscles, tendons, ligaments, nerves, blood vessels. It's really a complex of tissues wrapped together. This tool is absolutely amazing because it zeroes in on the areas of imbalance. So as I scan from bottom to top, the nerve temperature from left to right will help this deflector to indicate to me where there's more temperature compared to the opposite side. I'll mark that on the skin. That tells me exactly what area needs to be looked at. Another tool that I use to become extremely accurate in understanding where the source of your pain is called a pulsed electromagnetic field unit. This puts out a signal, different parts of the body from head to toe, left to right, front to back. And as I put it over different areas and press on different parts of your body, this will indicate if I get a strong or weak response. That also will help me to zero in on the source of where your pain's coming from. Very commonly, to understand the nature of muscles and what muscles should look like, they should look like these sponges. Very soft tone, kind of like a raw steak, very even and long. Our muscles are designed to encapsulate and protect nerves, blood vessels, and lymphatic structures, like a sandwich. And so the information sent from the brain down to different parts of the body have to pass out through the spine, spinal joints, and tons of muscles. And muscles kind of like our layer of an onion from the top to middle to the bottom layers. And when things go wrong, usually due to history of stresses from car accidents, falls, different types of injuries, many times not even recent, maybe a long time ago when you were a child, just problems were never resolved, the body will actually hold on to and catalog it and it always tries to adapt. And stressed muscles will look very much like these sponges. Compared to this type of sponge, we have a muscle here that has become shorter, thicker, and harder. And what happens is over time, this becomes like a vice grip to the structures that the muscles are designed to protect: nerves, blood vessels, lymphatic structures. And so if we were to zero in on how this affects these pain-sensitive structures, it kind of looks like this. This structure would signify a nerve in the body carrying signals and information. And here's a vice grip muscle that has gone wrong, that has become compressive, or known as a compressive lesion to that area, and it's vice gripping into it. So as you continue to turn your neck side to side, rotate it, bend it, same thing with the lower back, flexing, extending, or side bending and rotation. If you have areas like this in those regions, now you're creating friction. And as friction starts to surmount more and more, it elevates inflammation and then pain. Again, putting drugs into the system might be successful at suppressing signals, but ultimately it can never fix areas like this. And so we have a number of different treatment options when someone come in based on what we find. Sometimes we need to use a tool like this that goes along the planes of the muscle very gently and starts to break apart scar tissue, promoting better blood flow. The better the blood flow, the better your nerves and muscles work. Also, sometimes use a computerized device, and the computer sends a signal into these muscles that create what's called dosing. Excuse me, and dosing is where your nervous system and muscles that are imbalanced and deficient will start to take in the information that the unit is giving to it, and it's kind of like it's filling up its electrical potential, because the more electricity your muscles and nerves have, kind of like a battery, the more work it could do. Areas of deficiency or injury become very low in voltage or electricity. They become very weak. And the weaker those areas become, the less work and things it can do for you. And so the body sends you a signal of pain, attempting to let you know there's an imbalance there, there's something wrong. So I welcome you to come in. There's never a charge for a consultation or exam. I don't believe it should cost you anything to find out where the source of your problem is coming from, if you're a good candidate for care. And we'll sit down, take our time, and figure out where the source of problem is. Once we do that, then I can offer you some different options in terms of how you can go about getting this taken care of. Give the office a call, 480-219-0625. Look forward to meeting with you and ultimately helping to resolve your distress and problems that's holding you back from a lifestyle that you most want and enjoy. Pleasure talking to you, and look forward to meeting you soon.